All right. Aiden, I think we're ready to go here. Get us started. Good afternoon and welcome to today's UNT World Ask Me Anything Forum. I'm Paul Corliss, Chief Communications Officer for the University of North Texas System, and appreciate everybody making time for us today. I'd like to get us started here by introducing our panel, and we'll start with our host for today's event, UNT System Vice Chancellor for Finance and CFO, Dan Tenney. We have UNT System Vice Chancellor for Strategic Infrastructure, Steve Marashevsky. Our newest Vice Chancellor, UNT System Vice Chancellor for Organizational Effectiveness and Chief Human Capital Officer, Shireen Gilliam-Holmes. UNT System Vice Chancellor and Chief Information Officer, Chris McCoy. And last but not least, UNT Health Science Center Vice President for Finance and Planning, Chuck Fox. So we're going to spend time with each of these panelists today, and then we'll have some Q&A at the end. Let me just run through the format real quick, and then I'll hand off to Dan. So this is our second Ask Me Anything that we've done, and we're now planning to hold these Q&A sessions each quarter in between the Chancellor's quarterly town halls. We think that more employee communication is better, especially during this challenging time where many of us are working remote. So the idea is to provide more touch points to our faculty and staff across UNT World. Again, today we'll open with brief remarks from Vice Chancellor Tenney, followed by Steve Marashevsky, who's led our emergency response to COVID-19, Vice Chancellor Gilliam-Holmes, who's new in our HR leadership function, and then we'll move over to Vice Chancellor McCoy, and then over to Vice President Fox. And at the end, we'll have Q&A with participants, and we have many questions that were submitted previously via email. Thanks to everybody that did that. And we'll also be collecting questions in our chat room from the live webcast. So thanks to everyone for joining us and participating. And with that, if our panelists want to turn their cameras off, except for Vice Chancellor Tenney, Dan, we'll let you open things up and then we'll get rolling.
Very good. Well, thanks, Paul, for a great intro. Look forward to talking to everybody this afternoon. We started these last quarter as just a way for us to communicate with each other. During these times, I can think of nothing more important than us providing communications, collecting questions, and trying to provide as many answers as we can. So what we want to do today is just interact together. We've got a number of panelists here, but certainly feel free to ask any and all questions that might be on your mind in the chat area. We have a lot of questions that have come in already that we'll be addressing today. And so we're so thankful for employees, faculty, staff that sent in questions today. Paul, I think we're ready to go. We're looking forward just to an engaging session. We got a lot of good panelists here with us to help us sort of answer questions today. And I'm just looking forward to our interaction together. So I'm ready to rock.
Well, probably the busiest guy we've had in the UNT system during the COVID-19 pandemic is our first panelist, Steve Marashevsky, who has led that effort and really worked across the system to help keep us going here during this tough time. So Dan, I'll let you guys have a little talk and then we'll come in with some questions.
Yeah, so Steve, welcome. We can't thank you enough for your leadership. Steve has just really taken the banner of helping us to lead our COVID activities, working with all of our institutions and all the representatives at our institutions to help us during this time. So Steve, talk to us a little bit how we're doing. What is our case count looking like in the areas that we're impacted by? How's our student base doing? Anything you can share with us, Steve? And also, if you can tell us a little bit about the vaccine process that's happening. We've got a lot of questions that have come in about that.
Sure, be happy to, Dan. So we're doing extremely well, I think. We left in the fall with some serious concerns about returning because of the trajectory that was happening around us. And as we return, the case counts continue to rise, but frankly, we're having some very successful experiences at our campuses in proportion to what we're seeing happen around us. And I think some of it suggests and argues that in some cases, we create a safer environment, because our numbers are actually lower than the surrounding community. So that's a very exciting thing. Having said that, we're still at a point in time in this country, both locally, regionally, and nationally, where the numbers are high. So we need to stay the course. And that leads me to the vaccinations, because that's the hope, right? That's the hope that's on the horizon, and it's right around the corner. But it's not quite here yet. So we're at a point where we have to keep our excitement about what's about to come, keep that from causing us to go out in the marketplace and do things that we shouldn't do yet, because the market is still tough. It's still tough out there. So my biggest message to everybody is stay the course. Stay the course. The answer's right in front of us. I think it'll be here soon, but this is a key time to stay diligent and protect yourself and protect those around you. In terms of the vaccines, that's some good news there too. I mean, there was a slow start. Everybody's, I'm sure, seen it in the news and read about it. There were some fits and starts, but they're really ramping up. Initially, we were having trouble everywhere getting the vaccines distributed, and more importantly, actually get them into the arms of the people. A few weeks ago, we were running at about 30% of the vaccines that were distributed actually making it into people's arms, and now we're up around 76%, which is an amazing number, actually. That's about what you need on a regular basis, a continual flow. So the state has made a really big turnaround in that area, and that in conjunction with the fact that they've doubled our allocations recently means things are moving in a really positive direction. I can keep going, Dan. You want me to keep going, or you want me to?
Yeah, no, that's very good, Steve. And so I know we have a question, at least one question that's come in specifically about vaccinations for our employees, for staff, but especially faculty that are on the front line. Can you say a couple words about that, Steve, to see if we can address that question?
Yes. So the one thing that's going to continue to be a frustration is we don't get news until the last minute. So the way the process is working, there's an expert vaccination panel in the state of Texas. They meet weekly and they make decisions weekly, and they appear to come out as pretty rash decisions, but a lot goes into it, and they can't tilt their hand at any one point in time which way they're going. So we don't find out till the last minute. So we're constantly speculating. We have 2 campuses that have been approved to be providers. We stand ready. Our health sciences campus has actually received 300 doses and has administered it. We stand ready to accept as many as they'll provide us. And the intent is to provide them to our population on our campuses, the ones who are in the particular phases that have been approved, which are, right now, healthcare providers, frontline, people over 65, and people with health issues. That's what we're approved to do right now. So we're ready, and it's our intent to distribute to our employees as well as part of that group. But the question is, how many are we going to get at any one point in time? So that's the thing we can't answer at this point. So I continue to remind people to check with your providers. That's probably one of the best ways to get into the system. If it's not through us, look at alternatives. The providers and also the county health agencies are 2 locations, but my preferred method is your health provider, if at all possible.
Steve, a couple follow-up questions for you. The first would be, we have shared in our communications to the system through the HR department, we've shared the county websites based on where you live to sign up. Is that where you recommend to go first if you're, somebody that's at risk currently, that you're in one of those populations that's eligible?
Yeah, so again, Paul, I'd start with my provider, but if they don't have vaccines, there's nothing they can do. And then I would move on to the county websites. And I'd move to the county, but then there's also a large line there. And third step is to look at the website that shows all the potential providers in the area, which include pharmacies. And I hate to say this, but a lot of this is being on the phone at the right time with the right person. And I've had 2 family members who were successful. They started and it's a little bit scary and daunting, but it's a first come, first serve right now in many areas. And this is the reality of it. I've had 2 family members that started with 15,000 waiting on the line in theory, and ended up getting through as people gave up. in a day, so a lot of it is just being patient and diligent if you're in a hurry. There's also the case that if you can protect yourself and you can separate, there are folks that really need it more than others. All right. So jumping the line is not a good thing either. So I, for instance, am able to stay remote. So I've had opportunities to get vaccinated and I'm passing because I'm really not eligible technically right now. And it's best if the healthcare providers get it first. So use your conscience. Don't jump the line if you don't need to. There are people who need it more than others. But when you're ready, be very diligent and very patient. It does take a little effort.
And Steve, we've talked about faculty and staff and recommendations there. We also did receive questions related to students. What about student vaccinations? What's the plan there?
So they're further down the pike if you follow the federal list of recommendations. That doesn't mean that the state might not change that. The state has the opportunity to decide what the priorities are. We have several letters in. I know I've drafted at least one that made its way all the way to the governor, suggesting that especially our resident population be moved up. So we're still hopeful that students will be higher on the list, but we don't have any indication that they will. And that goes back to that. There's nobody tipping their hand at this point because I'm sure virtually every group is pushing to be moved up. But I think there's a lot of logic behind moving students up because they are transient, they are active, and there's also the communal living part of it. So I'm hopeful that we'll be successful getting them in the next round.
Awesome, thank you.
So Steve, hang out here with us. Keep the questions coming. I know we have a lot more COVID questions coming. I want to get some more folks up on the stage here with us. And by the way, as Paul said, as we go through these questions at the end, not even the end, but after we get through everybody, we're just going to have a rapid kind of Q&A as well. So keep the questions coming. I want to kind of bring forward this time Shireen Gilliam. Shireen joined us this month, actually. She's hit the ground running, and Shireen and I have had the pleasure of spending a lot of time together. Shireen came to us previously from Austin Peay. She moved here from Tennessee. She also previously worked for the City University System of New York. She also had an illustrious communications career. She worked in a lot of exciting places, including the Apollo. So Shireen, talk to us a little bit. What excited you? What are some of the big things that you're working on currently in human resources for our faculty and staff and employees?
Well, one, thank you, Dan. Honestly, you have really been a great, onboarding buddy, and everyone from the chancellor to all the vice chancellors and even to the HR staff really have just wrapped their arms around me. So I'm so appreciative of all the support. I think, 13 days in feels like 4 months. I think I said that yesterday. I think, when I just think about goals for the HR team and kind of where we are, I just think we're in a place where we have to kind of rebrand ourselves. There was a internal review done, and all of us in system headquarters, all of the departments have had this review kind of done to address our, gaps and opportunities for efficiencies. And so, we listened to the stakeholders. And, some of the feedback that we got was that, hey, your structure may not work for the campus needs. And so we're going to address that. So we will have a new HR structure that will be in place February 1st, and it really will align more with the campus needs. So each campus, due to their unique needs, we will have something specifically tailored to meet that, which is a fully functional and comprehensive skill set of HR staff on each campus to serve each campus needs. So I think we're really excited about that, and thinking about, on the heels of that, creating operational efficiencies, thinking about ways to automate and streamline, really, enhance that, employee experience, but really just taking a chance to look at ourselves and be open to new ways of doing things. And I think, lastly on our goals and initiatives really is like, how do we enhance that employer value proposition? UNT World is a powerhouse in this region as far as an employer, and we really want to be that destination employer, right? But how do we get there? We really want to tell the power of our story. I've only been here for 3 weeks, and just in casual conversations, someone says, hey, where do you work? And I say UNT. My goodness, everyone has a UNT story, but it's it resonates with me, you know, and it connects me more to the employer brand. So I think we really want to start to think about ways, you know, from an HR perspective, how do we, you know, sell ourselves? What's our compensation package look like? But, you know, now it's not always about dollars, right? It's about, you know, connecting to the mission of the institutions, connecting to the values. You know, people want to be proud of the place that they work for. And so I think that, you know, as we start to move in that direction, we have to really embrace, you know, how are we demonstrating, you know, diversity, equity, and inclusion? What's our standards of behavior to how we treat each other here? And then also, as we do get that top talent because of the power of our story, what are our growth and development opportunities? We really have to, you know, really be tied into really starting to build out people's skill set and develop that internal pipeline. So those are just some top goals, you know, for me in the HR space. I have a super talented, amazing team, and I'm so excited to get started on the work.
Well, Paul, I'll tell you, since Shireen came in, she has not wasted any time. You know, I don't think she let any grass grow, and as the chancellor told her, and she's just been it feels like you've been here all along, Shireen, and so we're just so happy to have you as a partner. But Paul, I know we've had a lot of questions come in related to human resources, and so want to get you to engage in this discussion and ask Shireen things that are coming in from our employees.
Yeah, and Shireen, one of the broad questions we received was what brought you here? What excited you about this opportunity? I've heard you talk privately about, you know, you were with a system in New York and then you wanted to have that campus experience. Now you're going back into a system situation. What brought you here?
Well, I'm going to tell a story. you know, I think what excites me most about this position is that the opportunity is bigger than me, to be quite honest. You know, there was a series of events that led me to this particular role. And I just feel like at this particular moment in my life, how the stars have aligned to bring me here, I just truly feel like I'm walking in my purpose. You know, the 100 Black men have a mantra, you know, what they see is what they will be. And that resonates with me because I feel like with this role specifically, you know, I'm a first generation college student. And I remember being on a college campus and really just not knowing how to leverage all those resources available to me. And so I'm really passionate about higher education, about service, about mentorship, about paying it forward. And I think that this particular role in the community that it serves, the positive imagery and the responsibility and the weight of this role just really motivates me. I'm really passionate in that space. And so just to have the opportunity to grow and develop people and to be a part of their story as people have been a part of mine, it really made this an attractive opportunity for me. And it's also a 360. The person that gave me my first start in higher education was the Vice Chancellor of Human Resources for the City University of New York. She hired me as a consultant, and to sit in a role really that she had 8 years later, I just feel like I'm walking my purpose.
Exciting to hear your passion. Question we had related to structure and customer service. I know that there was actually, while Dan was serving in the interim Chief Human Capital Officer role, there was a review conducted, and one of the points was to be more service oriented on our campuses. Have you dove into that? And if so, what are your thoughts there?
Yes, that's really kind of, you know, the nuts and bolts of why we're restructuring, right? We really need to be able to be agile, you know, really enhance our communications and our collaborative efforts across the campuses. You know, at one campus, they might already be doing something. We need to leverage that skill set and leverage that expertise. But this is really going to help us really broaden our skill set, broaden our capacity to do some really great and innovative work, and really start to meet people where they are. You know, the pressures of COVID-19, how we've had to pivot to remote work. We've had to show up differently as HR professionals because we really had to, you know, embrace not only that employee that we had in the office from, you know, 9 to 5. We have to embrace cats, dogs, children, you know, basketballs in the background. We've had to embrace the entire employee and really just wrap our arms around, you know, employee life experience versus just that daily employee experience. So I just think that our new structure really will afford us the opportunity to enhance our customer service and really meet the unique needs of each faculty and staff at each campus.
Absolutely. Well, the final question for this segment we have for you is one that's on everybody's mind, and we received it in a few different ways. The basic question is, what's going to stay the same and what's going to change after we're through the COVID-19 pandemic? For instance, are there still going to be greater opportunities to work remotely, and all the changes that we've endured during this unique time? What's going to stay behind and what's going to go back to how it was?
Well, I think, the past is behind us. We really have to be forward thinking. What COVID-19 has, along with all its destruction and grief and loss, it also has brought out some innovation. We have, in higher ed, the industry is known to be, or especially on the administrative side, very antiquated in our processes. And I think that, being thrusted into this remote environment has really pushed the envelope of how we deliver our service. But it also has shown us that we can do things a lot differently than what we thought in 2019. And so I think that remote work is here to stay. I think we've all demonstrated how effective we can be with telework. And it's almost like toothpaste out the tube, right? Once it's out, you can't really push it back in. So I think that, it's safe to say that, there will always probably be an aspect of telework because we've proved that we can do it. So I'm just really excited of what's ahead, because honestly, I think what COVID has done is definitely just made us look at ourselves, I think, as an employer, but as colleagues, as humans, differently.
Thank you.
Yeah, I think, Shireen, that's a really important point, and it's really making us examine how we're working together. So, Shireen, hang out. As soon as we get Chris and Chuck back, we're going to move to rapid fire, where I'm sure we got some more questions for you. So we're going to bring on Chris McCoy, our Chief Information Officer, and Chris has a really unique job because not only is he the Chief Information Officer for the system, he's also the Chief Information Officer at our flagship UNT. Chris, you came to us from Arkansas, University of Arkansas, and been here. I think you like to commonly joke that I think we were about 2 weeks apart, something in that realm. And been a pleasure to work with you, Chris. You got some big things happening. And I know that folks out there may, last time we talked a little bit about this operational effectiveness team. And then you stood up under that a project called Project Proteus that's really looking at how we transform information technology. Tell us a couple words, Chris, about where we're headed in IT and some of the transformations that we're trying to make.
Yeah, so just really quick, Project Proteus is a very aggressive project to really look at the way that we find efficiencies in our IT operations across the system. So there's some 17 different projects that we're looking at overall. And of course, operational effectiveness team set this target of a 20% savings, or about $15 million that we're finding throughout that. And of course, that's really capturing the majority of the limelight in terms of the work that we're doing right now. But there's also a lot of other great things as we pivot towards looking at the future about how we use technology to be able to come alongside and enhance our business and really help us be successful in the areas of education, research, outreach, and of course, administering our system. So lots of exciting things, both from an efficiency perspective and from an effectiveness perspective.
Yeah, I think it's really good, Chris. And for me, that's always a balance, right? Is trying to balance effectiveness and efficiency together. Paul, I know we've got a lot of IT questions that came in, and information technology is a part of what we all do. So Paul, you want to ask Chris some of the more specific things that we've seen come in from our employees?
Absolutely. Chris, this is one that I know that you've experienced, because I've experienced it in setting up events like this. Sort of the whole Zoom and Teams rivalry, if that's what you want to call it. Some people are more comfortable in Zoom, some are more comfortable in Teams. What are we going to rely on as we move forward long term? I know there's a project that Teams is sort of at the heart of, and I also know, talking to colleagues like Adam Fine, that there's faculty that are comfortable with Zoom. So can you kind of give us a rundown on those two platforms, or is there something else coming along?
Yeah, well, those are the two key platforms that we have invested in the system, obviously. And what we found to this point is that Zoom works extremely well in the classroom setting for how our instructors want to teach. They're familiar with the product. It aligns really well with them. It has great video quality overall. But Teams also is a great product, and it fits more in the collaborative space. It has capabilities to store documents and share notes and do chatting that stays with us and create all of these little teams and so on. but it also has a really great capability to be able to act as our telephone system. And that's the major thing where Teams is heading right now, is that over the next several months, we'll be working in waves to shift people's phone lines to be hosted through Teams. So your Teams instance will have a telephone number associated with it that is your current telephone number if you've got a phone sitting on your desk. And of course, some people will get phones on their desk that look like phones that are actually just single purpose computers running Teams. And others will access their phone through their computer system or their cell phone or their tablet or what other device they have. It's interesting to note, 12 months ago, we were just hearing about COVID and the pandemic. 11 months ago, we started this heavy shift into Teams. 12 months ago, we were running something like 1,000 hours of video a month maximum within Teams. First quarter of this fiscal year, 15.5 million hours of video. So we have flipped the paradigm. There is no way to put the genie back in the bottle on this, right? People are using it. It has become a way of work today. So it's here to stay.
Chris, another question that we've got that, I don't know how much of UNT World is aware of this, but our websites at most of the institutions, HSC is a little bit of an outlier, but UNT, UNT Dallas, and UNT System websites have been on the Drupal platform for as long as I've been here, more than 5 years, and I'm certain before that. We're going to be making a move from Drupal to a new product. Could you talk a little bit about that and what that timing looks like and how that will impact users of our websites?
Yeah. So we're going to be moving to really an off-the-shelf sort of a product to run our web infrastructure in moving forward. And I want to do a big call out to Charity Beck in Jim Burscheidt's group at UNT, who's leading this project. And so it's a combination of technical and content people that will be working on this overall. And it will roll out, begin to move in the next several weeks, and it's going to take us multiple months, maybe rolling out even over the course of a year plus as we shift sites from Drupal to this new platform Omni Update. And I think we've got something like 400 websites at UNT and a much smaller number at the system in UNT Dallas. But we'll be working together, both technical people and content developers, to be able to converge and move on to this new platform. The key thing that we get with this, right, is that we get a much faster delivery of content on the platform and much more consistency throughout as we have reusable pieces that work together. And so since our website we know is geared really towards mostly our external audience, this will really serve as a way to help unify our message to all of those prospective students, the prospective corporate partners, and others that really want to know what we're all about.
Absolutely. And I'll echo your thank you to Charity and Jim for helping lead that effort. They're kind of carrying the torch for my team as well. So I'd be remiss if I didn't say thanks also.
Chris, hang out. We got some more questions that are going to be coming your way, but I'm going to get one more guest up here before we do just rapid fire, and that's going to be Chuck Fox. Chuck, I want to bring you on to this discussion. You joined us in October 2019, in May. You joined us in May, and you were previously Director of Accounting Compliance and Capital Assets at UT Southwestern. It's been a pleasure to get to know you, have you on board. You brought a lot of experience to our Health Science Center. So maybe talk to us, Chuck, about some of the unique aspects that are happening at HSC relative to the COVID challenges that we're seeing.
Yeah, sure. Well, thank you for having me, Dan. I really do appreciate it. And at HSC, there are just tons of things happening all the time, and I've noticed that since I've been here. And one of the things we're continuing to do currently is we are doing a lot of contact tracing, which we've been doing for quite a while now, and we've been helping Tarrant County out doing that, and we're continuing to do that as long as they need us to do that. But some of the other initiatives that we're continuing to do even through COVID, we have our pediatric mobile clinic, which continues to bring much needed primary care services to kids in underserved areas. We have our mobile vision screening program, which is a no-cost screenings to Fort Worth preschoolers. We have our Center for Human Identification, which continues to do amazing things in the identifying unidentified remains using genetics and sending that to the FBI genetics database to help solve those unidentified remains, as well as combating sex trafficking and human trafficking. We also have programs at our Safer Care Texas Institute, which is has the purpose of improving the quality and the safety of healthcare in the region and throughout Texas. Those guys, it seems like they work 24/7. They are always coming up with new initiatives, and it's a pleasure to read through the upcoming things that they have coming up. Also, we continue to do work at our Institute for Translational Research, which identifies precision medicine approaches to dealing with brain diseases like Alzheimer's, Parkinson's, Down syndrome, dementia. And this institute, it's been very busy with federal funded grants in the health and aging brains and Latino elders. And it's also expanding that study to bring in African Americans to study the biology of Alzheimer's disease. And it has the potential to bring in just tons of resources and grow in size from funding sources of additional grants, as well as private development opportunities. And also our Texas Center for Health Disparities, which is one of 12 specialized centers in excellence in minority health and health disparities in the country, the only one in Texas, actually. And we're seeking to currently expand with seed money from the state that would potentially lead to self-sustaining funding sources in the future that would conduct evidence-based project demonstrations within the communities where health disparities exist. So those are just some of the few initiatives that we've continue to do during COVID-19. And as well as being responsive to the needs of the community whenever whenever we're asked to serve.
Chuck, our chancellor likes to say that each institution, there's not a one size fits all solution. Every UNT system institution is really different, and really the health related institutes are more different than the 4-year traditional universities, right? And you had a background where you were with UT Southwestern, now you're at atHSC. Can you talk a little bit on the differences and what that means to you?
Yeah, so I spent 20 years at UT Southwestern Medical Center, and it had very always obviously in the healthcare industry. And I guess what draws me to the healthcare industry is it's the helping of people. It's not just the education, which is very, very important, but it's also what goes into the research and the clinical aspects. And those kinds of things at UT Southwestern, just like at Health Science Center, are very, very important here. So it's really a pleasure to see, and read about the different aspects of the research, especially when great discoveries are mentioned in the news, such as like Dr. Sid O'Brien's Alzheimer's discoveries that are been mentioned lately. It's just an amazing thing to see that I work for an organization that is out there serving the community for the better and providing the clinical services that people need.
And I'm excited. I'm going to have Dr. O'Brien on our UNT System podcast here in a couple of weeks, and can't wait to talk with him. But kind of going off of the community piece that you mentioned, Dr. Williams, President Michael Williams, has been really deliberate in offering up HSC's assistance and help to Tarrant County Public Health during the pandemic. And as I've heard him talk, that's something that you guys would like to continue to grow that role as an authority in Tarrant County, and then even grow beyond that. Can you talk a little bit about what the plans are to sort of use the success that HSC has had during the COVID-19 pandemic as public, doing public good, to carry that off into the long term?
Yeah, we definitely have a great relationship with Tarrant County. We have the economic development aspect that we've been working with them for quite some time. But also, anytime that Tarrant County has approached us or asked us, or we've approached them to collaborate in the healthcare field, especially when you talk about things like the contact tracing, which was very important. We did a lot of things last summer also with testing first line responders. We tested a lot of firemen and a lot of people that are out on the front lines that were out in public during the pandemic. And they've come to us for additional contact tracing, which we're going to continue to do. And I don't have a lot of details on upcoming things that are coming up, but I you know, there may be some opportunities to assist with vaccine distribution and those kinds of things coming up. So we'll just have to wait and see. But anytime, you know, Tarrant County is needing some assistance, Health Science Center is always willing to lend a hand. That's for sure.
Chuck, you all have been a great partner with not only Tarrant County, but just all of our institutions with the state of Texas and all the advice that you've given. And I think it's a blessing during this time to have our Health Science Center so engaged in this national pandemic. So, Paul, at this time we're gonna invite everybody back up. I know we got a lot of questions that have been coming in, both live as well as others that we already haven't addressed. You know, and what I'd like to do is just let's just go through rapid Q&A here and have you go ahead and pose questions and additional things that have been coming in to our panelists, and we'll answer them the best we can.
Well, here's one for you, Dan. This one came in advance by email, and the question says, I wondered if the UNT system would consider changing the pay dates for employees because UNT pays employees on the first business day of a month. There are times each year when UNT forces me to pay late fees for my rent and other bills because my paycheck is late. For employees who pay rent, it's typically due on the first. Any option to adjust that?
Yeah, it's a great question. I mean, that, you know, as you noted, most of our employees are paid monthly. We do have some employees that do receive paychecks biweekly, and that's really mandated by the state of, you know, if there's below a certain salary level, we automatically pay folks biweekly. We have traditionally been on a monthly pay schedule. Unfortunately, those dates are set by the state, so we can't actually change the date. However, there are some institutions that pay everybody biweekly. That's something we could look into in the future, you know, to see if that's something we want to pursue. So unfortunately, we can't change the date, but we do have some flexibility to look at frequency. And so that's something we could certainly look to explore in the future.
All right. Well, this one, I think Shireen is probably best equipped to answer, and maybe there's an opportunity for Dan to weigh in. The question is related to UNT, and actually UNT Dallas is also considered a Hispanic serving institution. And the question is, are there steps being taken to compensate bilingual employees?
I know this is definitely something that we're going to look into. There are across industry, you know, options to have premium pay for certain skill sets. So it's something that we definitely can circle back to. Dan, if you want to chime in, I'll let you add to that.
No, I agree with you, Shireen. I think it's something we can look into. I mean, you know, typically as Shireen and I know, you're compensated based on the roles and based on, you know, where our skill base is. And so that's certainly something we're going to look into. So Shireen, I think you answered it well, and we'll circle back as we continue to look into that.
So here's a question that came in through the chat room, and Steve, we'll send this one your way. It's somewhat vague, but you're our coronavirus guy. So why are we, assuming UNT World, continuing to reopen when the whole country is not reopening, or when the virus is continuing to, you know, on that upward trajectory? Excuse me.
So is this one I can kick to Shireen, maybe? It's a complicated question, but I you know, it's there's a lot of thought that goes into it. First off, a lot of thought and analysis, and as you're all aware, we've chosen a different approach at our different campuses. It's not even a one size fits all. So it's about making sure you have the right resources in the vicinity of the campus you're working with. It's about what the students are requesting as well. It's also, you know, the resources we have on the campus to ensure we provide them a safe environment. And if you look around the country, frankly, there are some institutions where when students return, the regional rate goes up exponentially. We are not experiencing that. We're experiencing actually somewhat the opposite. We added population and the rate is somewhat declined in the Denton location, which it goes to show that, you know, our students are following the rules. They're doing the things we're asking them, and we're creating a nice, safe environment. If it were different than that, we would have had a different decision to make, I think. So it's not an easy answer, and it's not a simple equation, but suffice to say, there's a lot that goes into it. And just because we're doing one thing doesn't mean it applies the same to somebody at another location. So everybody's got to make this decision independently based on, you know, as I said, the conditions around us.
Here's another one for you, Dan. This one is, how has the pandemic impacted the state budget, and how might that impact higher education for the next biennium? Our legislature is just moving into session now, so very relevant one.
Yeah, so it's a very relevant question. So in late 2020, the Comptroller State reported that sales tax revenue fell almost 5%. And at the time, other revenues such as taxes on oil and hotel and gas were down about 40% year over year. Fortunately, some of that has rebounded, but most recently, our comptroller reported the state has a deficit of about $950 million. And so as we go into this biennium, the state is faced with a deficit, so they roughly $112 billion budget and revenues, but you know, almost $1 billion deficit. We faced a reduction in the current year and last year, so over the 2020 and 2021 biennium, we faced a reduction of 5% in most of our institutions. Our health science center did not suffer as much as they were exempted to a lot of that. But it has caused us complications as we lost state revenues. I believe the state is doing everything they can to help us to, you know, ensure that we can have a good session. We're just getting ready to go into session for the next budget up and coming, and so we're certainly making our case. And this may bleed over a little bit, but I would just say the federal revenues that we've received have helped us tremendously, but they certainly do not make up for all of our shortfalls. So the short answer is the state suffered almost $1 billion deficit. So the state has challenges as we go into a new budget session for sure.
So this next one is probably a tag team between Chris and Dan, but I'll start with Chris, and it's one that if you're involved with this particular software, I think you have some passion behind it, and then there are others of us that don't use it and probably don't know what we're talking about. It's a little in the weeds. Here's the question, Chris. Some of us are hearing that Hognose, which is a budget tool, will no longer be used as the budget tool that many of us are comfortable using in our daily work. If that's true, why toss it aside?
Yeah, Dan, that's your question, right? No, I'm kidding. You know, everyone's passionate about the software they use. And so we're trying to look at this in a probably a big picture way across the system. Data is incredibly important to us as a system, will be increasingly important to us as we move forward. And so we have a plethora of tools that we use across the system, a lot of different ways that we collect data, that we store data, that we process data, and we present data. And those differences tend to create confusion in the bigger picture. They may work really, really well in isolation, but when we try to bring it all together, it gets increasingly difficult. So part of the task, again, in the big picture is how do we look at ways to begin to converge on tools that help us see differently. Hognose is one of those in the conversation, and I think there's some things that we continue to look at with that. And I know that Dan and I have been joined to the hip in this conversation as we work through the many different aspects of answering that question. And so I'll let Dan add a little bit more to that, but that's probably what my answer would be at this point.
No, I think it's very fair, Chris. I would just say, one of the things we've asked Chris to help us look at is where we can save resources. We do have a number of reporting tools today, and each of those cost us money. And so if we can save resources by moving to more common platforms, it helps us. But Chris and his team are continuing to analyze this. And I just would say, Paul, on the question too, if we decide to make that transition, we'll make sure that it works effectively for us. I mean, that's part of the evaluation we've had Chris and his team to look at. and we would also allow adequate time to transition. So we want to make sure that we can do our business, and that any tools that we're adopting or moving away from, that we can continue to do our business. So, you know, Chris, I think it's a good answer, and we appreciate your team at least exploring these potential opportunities.
So this next question I have, I'll start with Chuck. It's HSC related, but there also is perhaps a human resources element to it that Shireen may want to weigh in on. And Chuck, the question is about fatigue at health-related institutes and at HSC specifically. You've got, you know, epidemiologists, for instance, working overtime, doing outside of their regular job, also doing media appearances or working with Tarrant County health officials. Is there a fear about fatigue for those employees working overtime, so to speak, because of coronavirus?
Well, that does sound like a Shireen question, actually, but I'll give it a shot. No, well, I mean, obviously, there's always concerns when you're dealing with those kinds of issues, because we do want, you know, obviously we're in a pandemic, and you say work-life balance, and the pandemic kind of throws all that out the door, because you're here, and you do have people that have specialty skills that are able to provide those services to the public that really needs it in this time. So it's really a catch-22. What do you do? But there does have to be some kind of balance at some point, because eventually it's going to be burnout, and we really just can't have that from that situation. So and with that, I'll let Shireen, if she has any additional comments on it.
Yeah, and Shireen, I'll even give you, we had another question come in that cascades nicely with this one. The question was, what, if any, additional mental health resources are being considered for faculty and staff during this challenging time?
Yeah, I think fatigue is real. I think it's very real, and it's been a rough year. You know, we've had a few pandemics, right? We've had some social unrest. We've had obviously the coronavirus. We've had some political stuff going on. Everyone is burnt out, and you know, we also have now had to merge our work and professional lives with our children at home, with virtual schooling. We're all exhausted mentally. So, you know, we're taking that very seriously. Our EAP, which is our employee assistance program, utilization rates are high. We do have that available to you as well. But we are looking into some on-demand therapy services. I'm working with Dan and Ron and the campus executive directors of HR to really figure out if we can leverage a tool that's already in place at one of the campuses and see if we can leverage it across UNT world. It's really going to provide some on-demand mental health and therapy. Just if you're in crisis, it's really important that, and I can't hit this message home enough, that if you are struggling, you know, please seek out help. You know, you can always email me, email one of your campus HR directors, and we will point you in the right direction. But yes, mental health and fatigue is extremely pivotal, and it's actually really increasing right now as we are all, you know, dealing with such a rough year.
Yeah, and I can also mention, since my team manages the HR website, if you go into the benefits section of the website, the employee assistance program is there as well. And I know we have some free counseling resources there as well. Moving on, this one, probably Dan with maybe a little bit of Chuck answer. This question is, how will the recently passed stimulus bill impact the UNT system and member institutions? So Dan, why don't we start with you, and then maybe Chuck can weigh in on how that impacts HSC.
Sure. So we're obviously very thankful to be included as part of the stimulus bill. Higher education has been hit very hard. I was in a national conference yesterday, different systems and across the board nationally, and Shireen knows this, having come from an institution in Tennessee. Everyone's been impacted, and largely what we've been trying to do is sustain operations on behalf of our students. In the first round of the stimulus bill, across all of our institutions, we received about $35 million. About half of that was for students, and the other half was for higher expenses and losses suffered by the institution. Most of it, though, for us across our institutions went to help out our students, to help them with tuition and other costs. This round, we actually fared better. We're estimating we're going to have about $54 million come to our three institutions. And there's a lot more flexibility in this round. You know, Chuck, you're a financial person as well. When I look at the numbers, and HSC will benefit from this, I think about not quite $1 million, 800K, something in that range. I think, as you and I would attest, it doesn't make up for all the challenges from our students and or our losses, but it helps. And so you want to just touch on some of the things that you all have been able to use, some of your resources for, Chuck, and how it's helping the institution to serve our students.
Yeah, it's a very good point, Dan. You're exactly right. The HSC is going to receive a little over $800,000 the second round. We got about, I think it was almost $700K the first round, but half of it goes directly to the students to help them, and that's really the most beneficial piece of it. The other half the institution did use. We used a lot of it to help us, pivot to the online learning platforms, and it does help. It doesn't cover everything. Obviously, we have a clinic as well, and we lost a lot of revenue there. We were not able to see patients there, so we're still impacted from lost revenue from that aspect of it. We did get some of it back in another piece of the stimulus package, not the CARES piece, but every little dime helps, and we're just fortunate that we could use it for good things for the students and to defray some of the costs that we're undergoing, responding to the COVID virus.
This for Dan, we actually have a follow-up on this question. Will students who qualified for assistance last term be able to reapply?
Yeah, so we're still receiving guidance from the federal government on this round. I will tell you that the new higher education relief funds have some different rules that are coming in. But we feel like we had a pretty good process last round. So we're going to have a way, because some of this, obviously, and a huge portion of this is going to go directly to students, just as Chuck mentioned last time, we had over half. And actually, Chuck, as you know, even some of the funding that came to the institution, which was half, a lot of that went to students too in the form of aid and grants. So yeah, there's no reason that students couldn't reapply for additional funding this round. That's what it's going to come in for. But we are still waiting on guidance. Last time we had very specific guidance that came in from the feds. We just received some very high level guidance from the federal government, from the Department of Education, and we're currently weighing through that. So, I think, Paul, as we get that coming in, we're going to get it out as quickly as we can, and we'll have a way to tell students how they can go about applying for the funding. But the short answer is yes, they can apply again. And we'll just have to work out the process of doing that.
Fantastic. We've got a couple questions left, and this one I'm going to throw Steve's way. It's related to athletics, but it's attached to coronavirus, and I think you're probably our best equipped person to address it. The question is, how are athletics handling the pandemic differently than other areas of UNT world? And will they, I'm assuming they as athletes, be vaccinated earlier than other populations?
So athletics in general are being handled differently, pretty much based on the conference or that they're in. So Conference USA and NCAA guidelines have specific requirements for competition, resulting in much more extensive testing. And it makes sense. I mean, if you can imagine, most of these sports are direct contact. So you want to create an even more safer environment. So they're tested more frequently, and the goal is to catch things quicker and get them isolated so that it doesn't spread if there is an issue. The other thing is they're also highly encouraged to create bubbles to protect, because these kids all want to compete, so they have a strong motivation to even be safer in most cases. Otherwise, they lose their privilege of competition. So it's mostly around testing and isolating more quickly that is happening. Now, in terms of the vaccines, I have not been a party to any conversations that suggest they would be vaccinated sooner than anyone else. I'm sure it's happening somewhere at a high conference levels, but I've not heard anything that's come down and is likely to happen.
And Steve, I don't know if you're equipped to answer. This is a follow-up from just me. I know that UNT Dallas was starting intercollegiate athletics this year, and frankly, I don't know the status on how that's going. Can you share anything related to that? Of course, they're competing at the NAIA level versus the NCAA.
Yes, and so that was a little bit complicated because the NAIA literally had they had very minimal guidelines. and we were concerned. So we've actually, that's a little bit different in that case, where we've instituted tougher guidelines internally than they were under via the conference. And they had some fits and starts, but they've been competing and continue to compete. And once we got the program up and running and felt like we were doing it safely, they've continued to compete in basketball and track and some of the other sports.
Appreciate that. that was kind of my own curiosity. I appreciate that. Here's one for Dan that actually came to us from the UNT Staff Senate. This question, and perhaps Shireen has a answer here as well, but Dan, we'll start with you. Will merit raises be considered implemented retroactively after budget resolution? And again, this was related to UNT because it came from that Staff Senate.
That's a Shireen question, right? No, no, I'll start, Shireen, and then you can certainly feel free to jump in. So as I mentioned a little bit ago, our revenue projections for this year are down. I mean, we are certainly experiencing losses. Many of our auxiliary areas, for example, are having a very tough time. So we certainly have not been exempt of that. And as you heard me mention, we suffered a 5% loss in our state funding level. So we continue to be very diligent and holding the line on our expenses. We're being very careful about new hiring across all of our institutions, for example, and also controlling our expenses. I will say we are very proud of our presidents and CFOs of the way they have managed throughout this. And I believe the way we have managed is going to help us be even stronger as we come out of the other side of this pandemic. Not everybody fared so well. People took different approaches nationally in how they dealt with these losses. So even though we have federal money coming in, we still are down. And that federal money helps, but it does not make up for all the losses. And just as a reminder, that's a one-time stimulus that goes up. And so we got to be very careful about adding cost. We just recently, though, as Shireen knows, we completed a study about our compensation plan. So we had a group that came in and studied us. They did a market analysis, and they had a number of recommendations that the chancellor and presidents and that we all accepted that are going to help us. And so we're going to move to a more simplified structure over the next year, moving to pay banding, which gives us flexibility and adjusting for market pay. We have some areas they identified where we need to make adjustments for the market. And then we also committed as a team to a living wage. So across all of our institutions, we are moving to ensuring that all of our hourly workers have a living wage. With that, we will consider and look at, as our finances allow, potential for any kind of, I would just say, pay adjustment. I do not want to say that we're going to commit to a merit. I think that what most of our institutions be looking at is potentially some bonuses or adjustments based on market and performance. As far as what some people think of as across the board, that's probably not likely this year, just based on the state of our finances. However, we're going to closely monitor that. And if it does allow for that, then we certainly would delve into that. Shireen, anything you want to add on that?
Ditto. No, I think that, even if we can't offer, monetary bonuses in that way, I think that, we can be creative. And I think also one of my amazing team members just sent me a message about, a possible option to allow for time off for outstanding performance. And that state law doesn't allow up to 4 days for this kind of leave. So thank you, Donna, for sending that to help me out here. But I think that that's something that, we'll look into.
Chris, I have one for you that talks about you being relatively new on the job. In your short time here, have you evaluated the service model in IT? Are changes on the horizon, or what changes have you made? I know that you have made some. So maybe just talk on the service model for IT. Obviously, you serve lots and lots of employees across the system as well as students.
Yeah, we've had lots of great conversation about the service models in use across the system. And so I think the short answer is that we're going to continue to work together on all of the different components of the service models to see how we can continue to improve. And all of those, they take the shape of everything from the practices that we use to how we organize and how we work together differently and so on. And so the short answer is we've done a little bit of that, mostly in cultural building, and we've got a lot more on the horizon. It will be a long-term focus for what we do in IT. It will be a never-ending focus for what we do in IT. So we're getting really good traction from a number of different teams throughout, and we're just going to continue down that path. In terms of anything that's radical, I don't see anything radical on the horizon. I think it's more of shifting towards standards-based methodologies and best practices overall.
So we've got another finance-related question. I'll start with Chuck on this, and Dan, I'm sure you can weigh in as well. But the question basically relates to the unknown with the pandemic, and things can be changing. And obviously, budgets were set making certain assumptions. What contingency plans exist in the budgeting at our institutions and at the system to be able to weather, if something tragic happens with coronavirus, and let's say that we don't move in a good direction and things get worse, what contingency plans exist?
So at HSC, leadership took the fiscally prudent approach last summer to go ahead and put plans in place because things did look very bleak at the time with the economy and the lockdowns. And so HSC became a much leaner workforce at the time. And so we kind of set ourselves up to be able to weather the storm for the years to come. And, it's caused, we've had to take our jobs, our duties and tasks, and we've had to divvy those out amongst the staff. And it's, people have absorbed that workload. But I think by planning up front, I think we've set ourselves up to actually be okay going forward. Provided that, like we all want, that the virus at some point, hopefully this year, will come to an end, or at least be near an end by the end of the fiscal year or the calendar year.
We sure hope so. Dan, any thoughts on budget plans and contingency plans should things go awry?
So I would say each of our institutions, we've worked really strongly over the last year to put in place models. And those models looked at various scenarios. And in those scenarios, they kind of tell us, what could happen. Ironically, as Chuck noted, or maybe just great planning, the models have actually come, kind of converged to very closely what we thought might happen. I'll just say that not get too complicated, but we ran regression on the models to see most likely cases, but those really gave us contingency plans, Paul. And I would just say that proactive planning, as Chuck knows, from each of our institutions in the system, where we really put in place things like freezes on travel, freezes on hiring. We reviewed our capital plans, and then we've begun to pursue a lot of integrated savings together, have helped us tremendously. But I would just say, we do have some contingency planning. We have not seen anything outside of our models. In fact, so far things have been a little bit better than we thought. That's largely been driven by better enrollment. We continue to grow at all three of our institutions, and we continue to just do a great job of advancing education for our students. So we're going to keep doing that, Paul. And we're going to keep looking ahead to make contingency plans as we go along. But so far, our modeling has helped us tremendously to set in place proactive steps so we don't have to have drastic consequences. As you heard me mention, as I talk to institutions across the nation, many of them have had to dip into just all sorts of reserves and stop strategies. But I think our planning has helped us to weather this storm greatly.
Steve, here's one for you that's facilities related, and it's attached to remote workers and students taking more classes remotely. Office and academic facilities with additional remote workers and students. Will we continue to be aggressive in pursuit of new facilities? Will we eliminate any?
Yes and yes. So I think the world's going to change when we come out of this. It's changing as we speak. So our needs tomorrow are going to be different than they were when the pandemic started. So we're looking at all space, whether it's needed, whether we can continue to do more remote, reduce the space need, and/or in many cases repurpose it to more strategic or different priorities. So at the end of the day, there's probably going to continue to be growth. And give you an example, at UNT Denton, there's a desire to grow the research, so we need specific research facilities, and that's likely going to require new facilities. On the other hand, there's a lot of facilities there that might be vacated as some of us do not return full time to need our space that might be repurposed to other priority needs. So it'll be both, but it'll be a restructuring pretty much across the board based on the new need.
Dan, I've got one more question for you, and then it looks like, unless anybody wants to send us anything else, that we're kind of reaching the end of the panel here. The final question that I think you're probably best equipped to answer, even though I've at least looked at all these reports that we've submitted, is what are our legislative priorities across the system? And I know that's a broad question, but if you can speak on sort of where your interpretation of that is, that would be a helpful one, and then we can close things up here. And thanks, everybody.
Yeah, so I mean, obviously our number one priority is around formula funding, state support, right? It just is so critical. It's been really challenging. While we lost resources, that we also lost state resources. Now, granted, the states had challenges, but the very first thing is us making the case to the state of the importance of higher education and the importance of sustaining funding in the formula. And then we have a number of special items that each of our institutions is pursuing. Our president's been extremely strategic and looking at areas and how we transform education. So each one of them has special items that we are looking to go forward with. We also, as a strategy, are taking forward requests for TRBs, and so we'll be looking to do that. We're just not sure yet how everything's going to work yet in the legislative sessions. Jack Morton and his team have been extremely helpful and just wonderful partners of preparing us for this session. We've never been in a session like this where we're looking at remote and how it will occur. But I will say our legislators are, they're keenly aware, I think, of our challenges. And so as we go into session, as I said, our number one thing is to sustain that formula funding, and then secondarily pursue those special items that we're asking about that we think are critical for the future of our institution. So we're optimistic. We're gonna come in strong. We think that our message from our institutions is very good in what we're doing for students. So we're looking forward, and we're going in well prepared.
Thanks, Dan. And I'm going to throw to you to close things up, but I did want to make one comment to the viewing audience here. I understand that at the start we did have a little technological hiccup. We will archive the Ask Me Anything form in its entirety on the UNT system website, as well as on the UNT system YouTube page. And we'll push that out in our system-wide HR newsletter so everybody can make sure and access that. So if you missed the beginning, we apologize for that, but we will archive the discussion in its entirety. And also thanks to everybody that sent in questions. And with that, Dan, I'll turn it over to you to say thanks to our panelists and wrap us up.
Yeah, so thank you to each one of you, Chuck, Shireen, Steve, Chris, Paul. Thank you mostly to our employees. This has been a very challenging year. Shireen nailed it. As a country and as a nation, we've had so many struggles this year, and we want you to know we're there with you. You have been unsung heroes. Our employees have just done a tremendous job of providing capabilities and services for our students. Ultimately, that's what we're here for: is transforming lives through this educational experience endeavor that we're all involved in. We can't thank our employees enough. We have been fairly, conservative in our spending on purpose. We have been conservative on our hiring, and we know that there's a lot of constraints out there with folks, but we wanted to be proactive, and we wanted to come out of this continuing to grow, continuing to provide value. Each one of you has done that and demonstrated that over the past year. So we just want to thank our employees, everybody from our staff to our faculty. We just can't thank you enough. I think people have just done a tremendous job. People have adjusted how they work, how they provide capabilities, and ultimately how we support our students. So thank you to each of you. We will look forward to the next quarter of doing this together, Paul. If there are any questions that come in late, we'll be happy to follow up on those. But this is really just an engagement for you. Hopefully you found today useful, and we appreciate everybody that hung with us to the end and asked all us hard questions today. Most of all, thank you to each of our guests today. Thank you. They didn't have a lot of time prepared for this. As you say, these are just really off the cuff questions that come in or things that were shot to us just recently. So thank you to each of you for joining us today. With that, we will sign off and just say, have a great day and hang in there. And thank you again for everybody's hard work.
Thanks, everybody.